Hello everyone, and welcome back to Total Vigor, your go-to source for health and wellness information. Today, we discuss the disease of malaria. In this video, we will delve into what malaria is, its impact on global health, and the importance of understanding its symptoms, treatment, and prevention. Malaria is a life-threatening disease caused by parasites that are transmitted to humans through the bites of infected mosquitoes. It is a major global health concern, particularly in tropical and subtropical regions, affecting millions of people each year. Understanding malaria is crucial as it not only poses a significant threat to human health but also has economic implications, hindering the development of affected regions. By learning about the symptoms, treatment options, and prevention methods of malaria, individuals can protect themselves and their communities from this deadly disease. With the rise of global travel and climate change, the spread of malaria has become more prevalent, making it essential for everyone to be informed and proactive in combating it. Join us as we explore the world of malaria and discover how you can play a part in preventing its spread in today's interconnected world. History of malaria. Let's take a journey through the fascinating history of malaria, a disease that has plagued humanity for centuries. The origins of malaria can be traced back to ancient civilizations, with early documentation found in texts from China, Egypt, and Mesopotamia. These ancient societies recognized the symptoms of malaria, such as fever and chills, and attempted various treatments using herbs and rituals. Throughout history, there have been significant milestones in the understanding and management of malaria. In the 19th century, the discovery of the malaria parasite by Charles Louis-Alphonse Laveran revolutionized our understanding of the disease. This breakthrough paved the way for further research and the development of effective treatments. Key figures such as Sir Ronald Ross, who won the Nobel Prize for his work on the transmission of malaria by mosquitoes, and events like the establishment of the World Health Organization's Global Malaria Program have shaped the perception of malaria over time. These advancements have led to improved prevention strategies and treatment options, bringing us closer to eradicating this ancient scourge once and for all. Causes and transmission. In this segment, we will explore the causes of malaria and how this disease is transmitted from person to person. Malaria is primarily caused by the Plasmodium parasite, which is transmitted to humans through the bites of infected female Anopheles mosquitoes. These mosquitoes play a crucial role in the transmission cycle of malaria, as they serve as vectors for the parasite. There are several species of Plasmodium that can cause malaria in humans, with Plasmodium falciparum and Plasmodium vivax being the most common and deadly. Each species has its unique characteristics and can lead to varying degrees of severity in the disease. Various factors contribute to the spread of malaria in different regions, including environmental conditions, population density, and access to healthcare. Climate change, urbanization, and lack of effective vector control measures also play a significant role in the prevalence of malaria. Understanding these factors is essential in developing targeted interventions to combat the spread of malaria and protect at-risk populations. Symptoms and diagnosis. In this section, we will discuss the common symptoms of malaria and the methods used for its diagnosis. Malaria typically presents with symptoms such as fever, chills, sweats, headache, muscle aches, and fatigue. These flu-like symptoms can vary in severity depending on the type of Plasmodium parasite causing the infection. Diagnosing malaria involves various methods, with the most common being blood smears and rapid diagnostic tests, RDTs. Blood smears are used to detect the presence of the malaria parasite in a blood sample under a microscope, while RDTs provide quick and accurate results by detecting specific antigens produced by the parasite. Early detection and prompt treatment are crucial in managing malaria effectively. Delayed diagnosis can lead to severe complications and even death, especially in cases of Plasmodium falciparum infection, which is known for its rapid progression. Therefore, it is essential for individuals living in or traveling to malaria-endemic areas to seek medical attention if they experience symptoms suggestive of malaria. Timely diagnosis and treatment not only improve outcomes for the individual but also help prevent the spread of the disease to others. Treatment and prevention. In this segment, we will explore the available treatment options for malaria and strategies for its prevention. When it comes to treating malaria, there are various antimalarial medications used depending on the severity of the infection. For uncomplicated cases, medications such as chloroquine, artemisinin-based combination therapies, ACE, and quinine are commonly prescribed. Severe cases of malaria may require hospitalization and intravenous medications like artesunate. Prevention plays a crucial role in reducing the burden of malaria. Strategies include the use of insecticide-treated bed nets to protect against mosquito bites, indoor residual spraying to eliminate mosquitoes in living spaces, and chemoprophylaxis for travelers visiting high-risk areas. Despite advancements in treatment and prevention efforts, challenges persist in the fight against malaria. Drug resistance, limited access to healthcare in remote areas, and funding constraints are some of the obstacles faced in combating this disease. However, ongoing research and collaborations between governments, organizations, and communities continue to drive progress in malaria control. By staying informed and proactive, we can work towards a future where malaria is no longer a global health threat. Global impact of malaria. In this section, we will delve into the significant global burden of malaria and its profound impact on public health and economies worldwide. According to the World Health Organization, malaria remains a major public health concern, with an estimated 229 million cases and 409,000 deaths reported in 2019. Sub-Saharan Africa continues to bear the highest burden of malaria, accounting for over 90% of cases and deaths. The socioeconomic consequences of malaria are far-reaching, affecting communities and healthcare systems in endemic regions. Malaria not only leads to increased healthcare costs and productivity losses but also perpetuates the cycle of poverty by hindering economic development in affected areas. To combat the global impact of malaria, various initiatives and partnerships have been established. The Rollback Malaria Partnership, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the President's Malaria Initiative are just a few examples of collaborative efforts aimed at reducing the prevalence of malaria globally. Through continued investment in research, prevention strategies, and healthcare infrastructure, we can work towards a world free from the burden of malaria. Current research and future outlook. In this segment, we will delve into the latest advancements in malaria research and the outlook for future control strategies. Ongoing research in the field of malaria is focused on developing effective vaccines, combating drug resistance, and implementing innovative vector control methods. Promising developments include the RTS-SARS-01 malaria vaccine, which has shown efficacy in clinical trials, as well as new antimalarial drugs targeting resistant strains of the parasite. Despite these advancements, achieving malaria elimination goals poses challenges such as emerging drug resistance, funding constraints, and the impact of climate change on mosquito populations. However, there are also opportunities for progress through increased collaboration, investment in research, and community engagement. As we look towards the future, it is essential for viewers to stay informed about developments in malaria research and advocacy. By supporting initiatives, spreading awareness, and advocating for continued efforts in malaria control, we can work together towards a world where malaria is no longer a threat to global health. Stay tuned for more updates on the exciting advancements in malaria research and the journey towards a malaria-free world. Conclusion. As we conclude this comprehensive guide to the disease of malaria, let's recap the key points discussed. We explored the symptoms of malaria, including fever, chills, and body aches, as well as the importance of early diagnosis and prompt treatment. We also delved into the various treatment options, preventive measures like bed nets and indoor spraying, and the global impact of malaria on public health and economies. It is crucial for viewers to prioritize awareness, prevention, and support for malaria control efforts. By staying informed, advocating for resources, and taking proactive steps to protect themselves and their communities, individuals can play a vital role in combating this deadly disease. We invite viewers to take action by sharing this video, supporting malaria research initiatives, or seeking more information from reputable sources. Together, we can make a difference in the fight against malaria and work towards a future where this preventable and treatable disease no longer poses a threat to global health. Thank you for joining us on this journey towards a malaria-free world. In sickness and in health, Total Vigor is committed to providing you with accurate and relevant health information. If you found this video helpful, share it with your friends and family. Remember, knowledge is power, especially when it comes to our health. If you enjoyed this video and want more tips on healthy living, don't forget to hit that subscribe button below. We encourage you all to share your thoughts and experiences in the comments section regarding today's topics. Let's get a discussion started. If there are any specific topics that you want us to talk about, please let us know and we will be happy to consider creating a video that gives insightful information to you and millions worldwide. Before you go, we want to express our gratitude for your time and support. Your comments and likes mean the world to us. Remember, a healthier you starts with small, consistent choices. Thanks again for watching, and until next time, stay healthy, stay happy.